In solution-focused therapy, we don't erase trauma. We don't minimize it. We work alongside it with deep respect and a focus on what comes next. SFT is not a trauma processing model, but it is a trauma-responsive one. It meets people where they are without reactivating pain or forcing retelling. We reframe trauma by focusing on resilience, on how someone kept going, on the tiny, powerful steps they took to survive. Instead of asking, "What happened to you?" we ask, "What helped you make it through?" What has kept you going all this time? This doesn't bypass pain, it honors it differently. It shines a light on the strength that coexists with suffering. We use future-focused questions to invite hope. What would recovery look like in your daily life? What would tell you that you're healing, even a little? Trauma often takes away control. SFT gives some of it back by centering the client's voice, goals, and pace. We ask about what's working now. What helps even briefly? What's one thing that gives you peace? And we track progress with care. Where are you now on a scale of 0 to 10? What tells you it's not a 0? SFT also uses compliments, carefully and intentionally. That must have taken so much strength. I'm hearing a lot of courage in how you handled that. These are not platitudes. They are mirrors reflecting back effort, resilience, and choice. For many trauma survivors, just being in the session is an act of bravery. SFT honors that. We don't ask clients to relive pain. We help them reauthor the story with themselves as capable, strong, and forward-facing. And always we stay client-led. If a client wants to talk about the past, we listen. If they want to build the future, we help shape it. The power of SFT in trauma work is this. It doesn't require full disclosure to begin healing. It starts where the client is and moves gently from there. Because post-traumatic growth is real. And even after devastation, clients can imagine, rebuild, and rise. SFT helps them do that, one safe, respectful, empowering step at a time.